Have you ever looked in the mirror and wondered how you can increase your nose projection? If you did, well, this video is just for you. Hi, I'm Dr. Edmond, Medical Director of Xeoul Clinic and Assistant Professor in UCSI University. And we have here...
I'm Dr. Koh. I'm a certified plastic surgeon from Xeoul Clinic.
Today we have a very interesting topic about nose augmentation. Nose augmentation is a very popular and sought after procedure in Asia. What do you think about it, Dr. Koh?
Yes, I agree with you, Dr. Edmond. Before I start to describe about the various methods to do nose augmentation, I will briefly discuss about the nose. The nose is actually a centrally located structure on the face. In a very ideal situation, it gives a very attractive face to a person. And the nose is a three-dimensional framework of soft bone, we call it cartilage, enveloped by the skin and also the inner lining. The nose has important aesthetic appearance function in terms of breathing. Now we have today is Dr. Loh with us to let me show you the facial attractiveness of the nose on her face. She's a very young Chinese girl here. You look at the nose here, as I told you earlier on, the nose is centrally located on the face, and if you drop two lines down from the inner aspect of the eyelid, both sides of the face, and you can see the nose is slightly a bit extra from the line that we dropped here. And if you draw two lines below the nose and just about the eyebrow here, so the nose is actually 1/3 of the total face area of the height. So this nose is, I would consider, is attractive. If you look from the side view, look at me, Dr. Loh. You look at the side view here. She has a very typical Asian nose. This is very flat nasal bridge here, and the angle is a bit more than 120 degrees here. So he needs some augmentation here if he wants. And the angle between the dorsal here and also the columella is just nice, it's about 100 degrees. And between the angle of the upper lips and also the columella is a bit 90 degrees. Rhinoplasty, or in layman term we call it nose job or nose reshaping, is actually a procedure to enhance the appearance and some of them the function of the nose. There are various methods, surgically and non-surgically, to improve the appearance of the nose. Dr. Edmond, can you tell us more about the non-surgical method that you commonly perform in your clinic?
Okay, in my clinic, we normally use fillers or threads to improve the projection of the nose. Filler is a very quick and convenient way to increase the height of the nose and projection of the nose. I normally use hard fillers so that it can actually provide support to the soft tissue to achieve the desirable results. Filler is also suitable to treat humpback nose, whereby the fillers can be injected precisely at the located area. One advantage of using hyaluronic acid fillers is the ability to reverse the fillers using hyaluronidase if there is present any undesirable outcome. The nose filler normally lasts about 1 year. Nose thread, on the other hand, is made up of PDO. It is also used to increase the projection of the nose. It is biocompatible and it can last around 6 to 8 months. It is normally inserted over the tip of the nose and the dorsum of the nose. While non-surgical techniques such as fillers and thread have their advantages, they also have their limitations. In certain cases, surgical methods are preferable. What do you think about this, Dr. Koh?
Yes, I agree with you, Dr. Edmond. Surgery is an invasive procedure, involving cutting, stitching, and also inserting any materials or implant to improve the appearance of the nose. Generally, surgery can be divided into augmenting the nose, or I call it in layman, increasing the height and the projection of the nose, or a reduction to the nose surgery, for instance, ALARplasty, or reducing the size of the alar or the opening of the nostril. The commonest performed procedure in Asian population are augmentation rhinoplasty, or we call it Asian rhinoplasty. This is a surgical procedure involving improving the height and the projection of the nose by insertion of certain materials or implants to the nose. The materials can be taken up from the patient body itself, for example, the cartilage from the ear or the ribs, or can be chosen over the synthetic materials, for example, a medical grade silicone or a Gore-Tex material inserted into the nose to improve the appearance and the projection of the nose. The second most common procedure performed on a typical Asian nose are alar reduction, or I call it ALARplasty in our terms. ALARplasty involves removing a wedge of tissue just below the nose and try to bring both the ALAR close together. So this one will give you a typical nice appearance of the thin and slender nose on the face, which is very commonly a sort of procedure in the Oriental population. Lastly, the procedure commonly performed are reduction rhinoplasty. This procedure involves opening up the nose and correcting the structural framework of the nose. This procedure is suitable for patient who has a crooked nose, for example, due to the previous injuries, or patient has a dorsal hump that need to be removed of the excess. This procedure can correct a lot of functional problems, for example, breathing or smell. The choice of surgical method depending on the analysis of the problem, and every individual is different. So the treatment regime is tailored according to the patient needs after the detailed analysis of the problems and discussion with the patients according to their goal and expectation, and the willingness of the patients and the doctors to undertake the procedures with the acceptable post-operative outcome.
Well, I agree with you. A proper consultation and assessment have to be done by a certified medical doctor to explain to you the available options according to your situation. This ensures that you receive the best outcome without compromising your safety. If you have any questions for me or Dr. Koh, you can comment down below or contact us in Xeoul Clinic. Thank you.